Hi everyone, so I'm Professor Lee, and I am going to be recording these video lectures for all of the chapters, and this is your very first video lecture for OT 101. We are going to start with Chapter 1, which covers the mechanisms of disease, diagnosis, and treatment. So before we get started, I just wanted to make a couple of notes about how these video lectures work. So you have the PowerPoints uploaded for you, and they include much of the same information that you will see here. However, I have put some additional notes into these PowerPoints, and when I go through each of these points on the slides, I may provide additional explanation for those points. Again, the notes in the red at the bottom are additional notes that are not included in the original slides, and so you may want to take particular particular attention to those notes there. Also, some of the chapters are quite lengthy, and so I have broken them up into smaller sections so that you can watch parts of the lecture as you have time. And that way you don't have to find your way back in the middle of another lecture that you've started and couldn't finish. So hopefully that will make it a little bit easier for you guys to keep up with the video portions of the lectures should you so choose to watch them. All right, so we start with pathology at first glance, and pathology are the traits, causes, and effects of abnormal conditions causing measurable changes in structure and function. This part right here, measurable changes, that's important to note. That means that it has to be measured in some way, via lab test, via radiology test, via major signs and symptoms, notable signs and symptoms, as in the way that a person walks, their major motor functions, any of those things can have measurable changes in the structure and function, and that is an indicator for a disease process or an abnormal condition being present within the person. Homeostasis is the internal stability of the body. So you'll hear homeostasis quite a bit throughout these lectures. And basically the way that I explain homeostasis is best is it's the balance between good and evil in the body. So your body is constantly trying to achieve this perfect harmony or this balance between all of the good that's going on and all of the bad that's going on. And that's kind of what your body systems aim to achieve all the time. 100% of the time, they are trying to get back to that internal stability or relative consistency in the body. Your symptoms can be negative characteristics or a departure from normal status. So a little bit here about symptoms. A couple of things you should know. First, they are negative characteristics. Symptoms typically are. People don't like them. However, they could also just be a departure from normal status. For example, if your blood pressure normally runs low, say you're very athletic, you're very in shape, and your blood pressure is normally what would be considered hypotensive for a normal person, any jump to a normal blood pressure reading of 120/80 in a person who typically runs 102, 108 over, say, 70, then that could be an indicator. So even though it may not necessarily cause symptoms for you, it's a departure from your normal status or the patient's normal status. So that's important to remember also. And then lastly, signs. And those are abnormal objective findings. So a couple of notes that I want you to know here. Signs of a disease often correlate with the symptoms. So if they have a symptom, it's typically an indicator for a disease process. In other instances, though, the signs of disease may be noted in an asymptomatic patient, which means the patient has no symptoms at all, as is in the discovery of a painless tumor or the finding of an abnormal blood pressure reading in a person with undiagnosed essential hypertension. All right. So syndromes are defined as a collection of signs and symptoms that characterize a disorder or a condition. And then next we have pathogenesis, and those are the stages of a development of a disease. So from the beginning of the disease to the end of the disease, those are the stages of development. That's what we refer to as pathogenesis. So the pathogenesis of a disease varies with the individual patient, the causative factors, and medical intervention. All of that makes sense, right? So the patient, depending on their overall general health, may develop the disease. The disease may play out in them a little bit differently than somebody who's in poorer health or is immunocompromised. Causative factors are a big deal, and then their medical intervention. If they're able to get medical care to stop or halt or even reverse disease process, then that's going to make a big difference in the pathogenesis of that disease in that person. Acute illness is the abrupt onset of symptoms that run a brief course, brief being the key word there. So remember that. An acute illness, in case you're wondering, usually lasts no more than 6 months. 6 months seems like a long time to be sick, but in the grand scheme, when we get into these chronic illnesses, you'll see very quickly that 6 months is actually a very short duration for a serious illness. Chronic illness are diseases that develop slowly, and they can also be intermittent. And what that means is that they may present with signs and symptoms and then appear to relapse and then reappear again at a later time. These chronic illnesses will last longer than 6 months, and persons who have continuous pain as part of a chronic syndrome often experience depression. And I put that in there because I just moved here a little less than a year ago from Indiana. In Indiana, the town that I live in, there have been several pain management clinics that have been shut down and doctors who have had their license suspended for improper prescribing procedures. This is the thing that you should know. If they have chronic pain or continuous pain that is a part of another syndrome, they will often be referred to a pain management clinic to help manage their pain because, nobody wants to be in pain for that long of time. What is often overlooked, unfortunately, is the fact that depression also sets in as a subsidiary of chronic pain. And so sometimes it's important to know that we may need to refer to mental health services as well. Okay, so mechanisms of disease. We have something called systemic health. It may also be referred to as internal equilibrium, so you may hear it that way. It's preserved by numerous body organs and structures that work in concert to meet specific cellular needs. So all of these body organs and structures, they are all working together in unison in order to meet specific cellular needs. A note here, human disease is a universal occurrence. It has varied manifestations, any of which will threaten a person's ability to adapt to internal and external stressors and also to maintain a state of well-being. So that's important to remember. Disease can disrupt, and it does disrupt the body in many, many ways, and that's what they're talking about here when they say manifestations. Major disruptions. Any disruption of the body's equilibrium produces degenerative changes at the cellular level that may produce signs and symptoms of a disease. Some of those may be fluid and electrolyte imbalance, acidosis, and alkalosis. So some predisposing factors are involved when we are looking at the mechanism of disease. Those include age, gender, lifestyle, environment, heredity, and immunodeficiency. So although the recognition of risk factors may be significant in prevention, diagnosis, and prognosis, it does not precisely predict the occurrence of disease, nor does the absence of predisposing factors necessarily protect against the development of disease. So let's talk about some of those. You have changeable predisposing factors. So these are things like your occupation, habits, or one's usual manner of living that can have negative cumulative effects that can threaten a person's health. There are some lifestyle factors here. We have smoking and excessive drinking, definitely can affect your health. Risky sexual behaviors, again, definitely can negatively affect your health. Poor nutrition and lack of exercise, and then psychological stressors. Those are all things that are involved with a person's lifestyle, and they can negatively affect the person's health. Then we have environmental factors that can also affect health negatively. Things like air and water pollution, chronic psychological stress, poor living conditions and excessive noise, and then geographic location that's conducive to disease proliferation. So that last point here, I just wanted to make a note about that. This geographic location conducive to disease proliferation. There's actually a very well-known movie called Aaron Brockovich, that's the name of it, based on the town Hinckley in California, that had several members of the community there develop various manifestations of cancers because of the levels of I think it was chromium maybe, in the PG&E plumes in that geographic location. So all of this stuff was seeping out into the soil and into their water and was causing the people who lived in that town to develop multiple tumors and neoplasms. So that's one example. There are many, many examples of how geographic location can be conducive to disease proliferation. Many of those do involve air and water quality, but that's just one brief example of how that could be a factor in negative health impact. So there are also non-changeable predisposing factors. So these are things you basically can't do anything about. We have age. Complications during pregnancy and postpartum occur with age in women over 35. Maladies, there are also maladies associated with aging, which basically means that as you get older, you can expect that some things will not stay the same. Things will not function the way that they once did. Many people start to wear glasses or corrective lenses when they age because their vision starts to go a little. Many people develop hearing loss and will have to wear hearing aids. It's just part of aging, unfortunately. There are also some increased risks of diseases that are simply intrinsic to one stage in the human life cycle. And so basically what I mean there when I say intrinsic, it's just they kind of go hand in hand with getting older. So it's just as a person ages, they are at a higher risk for osteoporosis and osteoarthritis because their bones lose some density. So it's just, it kind of goes with the territory of age. There are also some things that are associated with gender, as in some diseases are more common in women, some of them are more common in men, and we'll talk about those as we go through the semester. Hereditary includes family histories. Unfortunately, as much as sometimes we would like to choose our family, we can't. And so if there is a hereditary disease that has been passed down from family member to family member to family member, or is prevalent in a group of family members, for instance, a lot of the women in the family have breast cancer histories, or a lot of the men in the family have a history of prostate cancer, then that's something that we cannot change, unfortunately. Factors of hereditary affect males and females equally, and we'll talk about why that is the case in later chapters. So immunodeficiency is another mechanism of disease, and that involves risks which depend on which components of the immune system are inadequate. So depending on where your immune system is lacking, it's going to determine how well you can fight off other diseases that may present themselves. So let's talk about what happens next once a disease is introduced to the body. We have a process called acute inflammation, and that's the normal protective physiologic response to tissue injury and disease. So a note that I would like for you to remember is that injury and disease impose stress on the body's equilibrium, and they disrupt or destroy all the cellular functions. These acute inflammation reaction is usually accompanied by redness, heat, swelling, pain, and sometimes loss of function. Not all the time, but sometimes we have loss of function. Widespread inflammation is marked by systemic symptoms, which means that you have symptoms in an entire body system, such as fever, malaise, loss of appetite. Blood testing may reveal an elevated white blood cell count or an elevated erythrocyte sedimentation rate, which is sometimes, and a lot of times, actually just called a SED rate. So what happens is you have this inflammatory response, and even though it looks like all of these things are going wrong wherever you were injured at the site of an injury or an illness, they're actually things that are going right. That means your immune system is doing what it's supposed to do. And also, too, these symptoms, this redness, heat, swelling, pain, loss of function, those are all things that are an indicator for you to know that something wrong is going on and you may need treatment. So intensity of inflammation is going to depend on the cause, the area of the body involved, and the physical condition of the person. Acute inflammation attempts to wall off, destroy, and digest bacteria and dead or foreign tissue. So things I would like for you to know about this is that there are vascular changes that allow fluid to leak into the injured site, and this fluid contains chemicals that permit phagocytic activity by white blood cells. And what that means is this fluid allows certain types of white blood cells to go and eat these bad bacteria. Acute inflammation also prevents the spread of infection through antibody action and other chemicals released by cells. A normal inflammatory response can be inhibited by immune disorders, chronic illness, and or the use of certain medications, especially long-term steroid therapy. So there are certain things that can inhibit this otherwise normal inflammatory response, which means that if there is an inhibition of this response, then the body will have a harder time fighting off this type of infection. After the insult is contained, then repair can begin. So when the inflammatory response is chronic or too intense, damage to the affected tissue can result. So just kind of be aware of that as well. Infection is something that is caused by pathogens. When a disease-causing organism finds ideal conditions in which to grow and multiply in the body, they cause disease first by invasion and local destruction of living tissue, and then secondly, by intoxication or production of substances that are poisonous to the body. So let me give you a little bit of an idea of how that works. So these disease-causing organisms finding ideal conditions, we were talking about that up here. Oh, I don't know where my clicker went. There it is. Ideal conditions. Bacteria love to live in damp, dark, warm places. And it so happens that the inside of your body is damp and warm and hopefully dark, unless you've got light shining in there somehow, some way. So that provides, the inside of your body provides ideal conditions for these bacteria and other pathogens to grow and multiply. And so then once those are there, they have invaded the body and have destroyed local living tissue. Then they will release substances that are poisonous to the body, and that's typically when you start to develop symptoms. You have signs of an infection that are redness and swelling, heat and pain, and also fever. You may also have the presence of pus and enlarged lymph glands. Symptoms include a fever, headache, body aches, weakness, fatigue, and loss of appetite. So we have several sources of infection that you need to be aware of. The first is endogenous, and that means it's an infection that has come from inside the body. Then we have exogenous, which means that it's come from outside the body. There are a couple of modes of transmission, direct or indirect physical contact. So direct contact is where you have touched one another. It could be sexually transmitted, could be skin infections like staph infections or bacterial infections from touching the exudate or the pus that has come from another person's wound, which I know sounds disgusting, but if you're married or a parent, you probably know that it's not really easy to avoid touching the people in your house 100% of the time. For example, if a kid has poison ivy and the oil from their rash rubs off onto you while you're trying to treat your child for poison ivy, it's very likely you will also end up with poison ivy. So just kind of be aware of that. I put a note in here, a communicable disease or contagious disease can be transmitted directly from one person to another. So there are lots of non-communicable diseases out there, but communicable diseases typically are transmitted directly from one person to another. An example of indirect physical contact would be like, again, if somebody has C. diff, we'll say C. diff. C. diff is a really nasty colon infection, and they use the toilet in the home. And the bacteria from C. diff are left on the toilet seat. Obviously, you're not going to be able to visually see those little tiny microscopic bacteria, but they can be left on the toilet seat, which can then introduce them to the next person who sits on the toilet seat. And they can pick up C. diff from that. So just kind of an idea, even though those two people obviously weren't touching butts, they were indirectly touching each other's areas on the toilet. Then we have inhalation. So if you can inhale people's respiratory droplets, if somebody sneezes, you can catch a cold. You can catch tuberculosis on the more extreme end. There's lots of things that you can catch via inhalation. Also, ingestion of contaminated food or water. You get a lot of Hep A cases with contaminated food. And then lastly, inoculation by insect or animal. So there's a big deal right now about the Zika virus with pregnant women that is being carried around by mosquitoes. Mosquitoes have also been known to heavily carry malaria in certain areas of the country. So that would be an example of an inoculation by an insect or an animal. Another would be like rabies. If you're bit by a raccoon, or I don't know who gets bit by a raccoon, but if you're bit by an animal, maybe a dog that has rabies, then you could develop rabies. So that would be an inoculation by an animal. So we want to prevent infection. That's the key. Now you have natural, mechanical, and chemical barriers available to you. So your natural, mechanical, and chemical barriers include things like your skin, your inflammatory response, your immune response. So when these mechanisms of defense fail to contain or eliminate infection, appropriate and prompt medical intervention is going to be required so that we can treat the host and to control the transmission of the infectious disease. So if your inflammatory response and immune response aren't cutting it, then we want to make sure that you get to the doctor and get supplements, supplementary medications or treatments so that you can get rid of that infection and not pass it around to everybody else. Isolate and identify organism and start treatment. That's the goal. So we may provide analgesics for pain and antipyretic agents to help bring down a person's fever, as well as other comfort measures. So those can be dispensed. We want to push adequate fluid intake, infection control measures such as washing hands, wiping down counters, that kind of thing. And also push that rest is going to be important for management of the infection. If necessary, we'll isolate the individual and implement immunization programs. And then there are very strict reporting requirements for certain infectious diseases that we have to report those to the health department, who then reports them to the CDC. If you ever want to know what kind of infectious diseases are going around in your area, the Centers for Disease Control and Prevention publishes notifiable diseases in the United States. I follow CDC on Facebook because they post regional and national updates, so that's kind of neat. I look at the CDC's website quite frequently. My background, my master's is in public health, and so the CDC, that's kind of what they do, is public health. And so you can find all kinds of crazy stuff on the CDC website that will make you never want to leave your house, never eat out in public again, and never drive a vehicle, or basically breathe. You just kind of don't want to breathe, because you can catch all kinds of stuff, and all of that stuff's on the CDC website if you're ever bored and want to completely freak yourself out. All right, so superbugs are virulent, antibiotic-resistant strains of bacteria. So it's pretty commonly known that bacteria can typically be treated with antibiotics. However, these superbugs are resistant. They're antibiotic resistant, which means that antibiotics do not help with them. MRSA is a very well-known superbug. It is to blame for skin and tissue infections, and it is the leading cause of surgical wound infections. Sorry, my dog was doing something weird. Excellent hygiene practices help to prevent spread of MRSA. MRSA is methicillin-resistant strains of Staphylococcus aureus, which is MRSA abbreviated because nobody wants to say that all drug out. It began showing up in hospitals, jails, very crowded living quarters, and other community environments. Many MRSA strains of bacteria are currently resistant to several different antibiotics. I don't know if you guys remember a few years ago, it's been probably 8 years ago maybe, there was a big nationwide outbreak of MRSA, and they were shutting down entire school systems to deep clean all of the school buildings because MRSA was being passed around all the kids, because they're in a crowded quarters. And even though they don't live together, kids are gross. Kids are super gross. And so they like to share all kinds of fun stuff, like their skin and their wounds. And they may rub up against each other in lunch lines or on the playground when they tackle each other, or whatever it is. They may share their personal hygiene items, and so they don't know any better. They're kids. And so things, even though these kids weren't living together, MRSA was breaking out in schools everywhere in the Midwest because kids are crowded in these classrooms and they are in close quarters. So that doesn't necessarily mean that they have to live together when we're talking about crowded living quarters up here. It just means that they are in tight spaces together for a while, for a certain amount of time. So the last point here about MRSA, occasionally toxic and resistant strains of MRSA have been termed flesh-eating bacteria because of the rapid spread of infection resulting in destruction of human skin. Let me tell y'all, I have seen this. It's nasty, nasty. This MRSA, this bacteria literally starts to eat the skin. In fact, once we got the patient healed, the MRSA had happened on the back of this little girl's calf, and there was a dip. There's a dip. It's probably a good half an inch, 3/4 of an inch deep dip of missing tissue out of the back of her. It looks like somebody just took a scoop from an ice cream container, took like an ice cream scooper and scooped out part of the muscle on the back of this poor little girl's calf, because that's where the MRSA ate her flesh, literally, and then down into her muscles. So this type of MRSA is super bad. Okay, the next one is VRE. VRE is a very big problem in chronic care facilities, and VRE is vancomycin-resistant enterococci. It's an increasing problem in chronic care facilities and hospitals because there are only a few antibiotics that can be used to treat VRE. Vancomycin is a very good antibiotic, and so now that we have this strain of bacteria that is vancomycin resistant, it's hard to treat these particular types of infections. CRE is another cause for concern. It occurs among patients receiving treatment for other infections. So recently, the CDC has sounded an alarm about the incidence of carbapenem-resistant enterobacteria. There's a whole big, you can read that. CRE, infections that are difficult to treat because they have high levels of resistance to even the last resort antibiotics. So this is the thing. There's a big public health campaign going on right now about antibiotic resistance. We don't give antibiotics as standard practice anymore unless it is absolutely possible or absolutely necessary to do so. So years ago, for years and years and years, decades, we would have patients come in and they would have a cold and a little bit of a respiratory, business going on, a little bit of a respiratory infection. And so automatically they would go on amoxicillin, or they would go on erythromycin, or they would go on vancomycin, or they would go on some other type of antibiotic. Well, public health studies and research studies have shown that if left untreated, typically those infections can be resolved by the person's own immune system, barring that they are not immunocompromised. So if we leave them go, they will eventually fight that cold off, or that little gunk up in their respiratory system or up in their sinuses on their own via their natural defenses of the respiratory system. So this is the other thing with antibiotics. When we were prescribing all of those antibiotics, and even now, people do it all the time, people will take antibiotics for a day or two, 3, 4, they'll be on some amoxicillin, and then they start feeling better. And once they feel better, they stop taking their antibiotics and think that they'll save them for a later infection to save them a trip to the doctor. Well, the problem with that is when you do not take the entire prescribed course of antibiotics, you build up an antibiotic resistance. So if the doctor prescribes amoxicillin again next year when you get bronchitis and actually need the antibiotics, they will be a little bit less effective for you because you have built up a resistance to the medication. And that happens every single time people don't follow through with their prescribed course of antibiotic treatment. So what that means is that we have all of these superbugs that have been developing because everybody has developed all of these high levels of resistance. And even to our super antibiotics, we now have bugs that are developing high levels of resistance. And that is a very, very dangerous place to be in healthcare. It's very scary right now from a public health standpoint that we have all of these superbugs developing and all of these CRE infections that are coming about because they are resistant to even the last resort super antibiotics. So if you are prescribed antibiotics for one reason or another, I strongly suggest that you take the full 7 to 10 day course, unless you're on like a Z-Pack and it's 5 days or whatever it may be, but you should definitely be taking your entire course of antibiotics so that you do not build resistance for when you really need them later on. Okay, step off of my antibiotic-resistant podium and move on to genetic diseases. So every cell has 23 pairs of chromosomes. You have an X and a Y chromosome, and those are your sex chromosomes. Each cell contains a genotype, which is a genetic code. You have a karyotype, which is an ordered arrangement of photographs of a full chromosome set. And then we have genes, and those are small stretches of a DNA molecule situated at a particular site on a chromosome. So genetics are the study of genes and their heredity, and they will continue to occupy center stage in the practice of medicine. And that's because genetic studies are what help us cure major ailments. I'm not going to go too much into genetics itself as we go through these diseases, but there are fascinating research articles out there. Actually, Kaiser does quite a bit of research within these genome studies and genetic studies, and so these are very, very expensive studies to do. They are very lengthy studies to do, but what they hope to gain from these genetic studies is to alter the course of treatment for genetic diseases or for exogenous genus diseases also. Okay, so some causes of genetic diseases include the abnormality in a genetic code in a single gene. Could also be several abnormal genes which produce so-called polygenic diseases, so multiple genes involved, that's what polygenic means. Abnormal presence or absence of an entire chromosome, so they may have an extra chromosome or a deletion of a chromosome altogether, or an alteration in the structure of chromosomes. So the chromosomes may be out of order, is basically what that means there. Mutations also are a problem, and they change the genetic code. So I put some notes in here that I want you to be aware of. Harmful genetic mutations or changes in the genetic code are passed from one generation to the next, and they may occur spontaneously or be caused by agents known to disrupt the normal sequence of DNA units. Lastly, agents called mutagens that can damage DNA include certain chemicals, radiation, and viruses. And those things are all, chemicals, radiation, and viruses, all helpful, or excuse me, not helpful, definitely not helpful. They are all harmful to one's health and well-being. So modes of inheritance, we have the first one here is autosomal dominant, and that's where the mutant phenotype is seen even if a normal gene is present on the other chromosome. Examples of these autosomal dominant inheritance are Marfan syndrome and Huntington disease. We have autosomal recessive, which is where a gene is insufficient to produce the mutant phenotype in the presence of a normal gene on the paired chromosome. Examples here include cystic fibrosis and phenylketonuria, which we'll talk about later on both of those. X-linked, which are also sex-linked recessive. This is a gene that's located only on the X chromosome. So examples of X-linked recessive are Duchenne muscular dystrophy and hemophilia A. So a note here, the mutant gene may produce an abnormal protein that causes a disease, or it may fail to produce its normal cellular function altogether. Hereditary diseases are often noted at birth, but they may not appear until later in life. And you see this a lot with specific hereditary diseases. So they may have this disease process and they have no symptoms until the child hits puberty. And then all of a sudden all these symptoms will start popping up, and it's very confusing for parents to find out that this was actually something that was a genetic disorder or something that was inherited because they had no symptoms up until they were 11, 12, 13. So that's about all we have for modes of inheritance. So genetic counseling is a communication process that is centered on the occurrence or risk of occurrence of a genetic disorder in a family. And what that aims to do is to help bridge the gap between complicated medical and scientific concepts. It also aims to help the family understand the diagnosis, course of the disease, and any available treatment options. And then lastly, it discusses testing and the benefits of testing of genetic counseling, or testing of genetic disorders or for disorders. So for many genetic diseases, the responsible gene or chromosomal abnormality has already been identified, and it's possible to test for the presence of a mutation in an individual. So for example, if you have two parents who have a family history of cystic fibrosis, they may want to undergo genetic testing or screening and may find that beneficial to decide whether or not to have children, because that genetic counseling or genetic screening will help them figure out the likelihood of their offspring having cystic fibrosis. So just kind of a thought there for you. So counselors are available at most major hospitals, genetic counselors are. Such counseling should be offered to all families affected by the diagnosis of a genetic disease in one or more members. Okay, so that's it for chapter 1, part 1. We'll pick up part 2 starting with cancer. So I will talk to you in the next video.